Welcome. Welcome to part 2 of Preceptor development. I hope you're enjoying this series. Today we're going to talk about how the preceptor is often considered as a bridge. So this is part 2. In the last section, part 1, you learned about the clinical judgment model and the ladder of inference. Today we're hopefully going to give you a couple of case studies and a little background work so that you can actually start to use the clinical judgment model. And again, just a shout out to my colleague Janet Monagle from Endicott College and the American Nurses Association, Massachusetts. And I am Cheryl Williams, Massachusetts Rhode Island League for Nurses and NLN Constituent League, President-elect, and Associate Professor at Salem State University. So the objectives: by the end of this module, the participant, you, should be able to develop confidence in utilizing the clinical judgment model, identify strategies to assist the novice nurse in the utilization of the clinical judgment model, and provide application of the model in the precepted experience. So how can we as preceptors help bridge the gap to practice, readiness, and excellence, particularly in clinical judgment? And there is a large enduring practice academic practice gap, and we know that. And so therefore you are critically important in providing this seamless transition from school, academia, into practice. So one of the things that I often think about is you need to be able to help with assessment techniques, point out salient aspects, and we'll talk a little bit about saliency today. Get your novice nurses to begin to recognize patterns, process the meanings of those findings, and mentor their thinking. So we'll talk a lot about role modeling today as well. So what is salience? First of all, what is salience? Salience, or saliency, is being able to recognize what is more or less important in a clinical situation. Novice nurses learn how to prioritize actions, reflect upon what they've learned from prior experiences, and then to improve the care of the next assignment, right? The process of critical thinking and improving your clinical judgment. This deliberate activity associated with experiential learning over time creates a sense of salience about what seems similar and not so similar in these situations. And therefore, ultimately, if there's nothing different, right, or salient, the student no longer has to do this conscious, deliberate action each time. But then when something unique or unplanned comes along, that sense of saliency, okay, something's different here. So that stops you from your higher level of just deliberate. You have to then go down to deliberate thinking. And what's different here, and why, and how should I respond? So how to teach for saliency. Many people use case studies or tell stories, otherwise known as narrative pedagogy. And in Benner's book, Educating Nurses, A Call for Radical Transformation, which I highly suggest, it's in the reference list. But she uses an exemplar, Diane Pestoli, as a teacher for teaching saliency. And this teacher in the book talked about the use of case studies. I increased the use of case studies as a teaching aid. I have a few case studies for various cases. But anytime I tell a story, I get positive feedback because it's what makes it stick. It's what makes it alive, makes the case come to life for them. It makes them see their patients more clearly. And when others harp in, they bring their perspectives as well. So then you can say, okay, well, here's the rule, right? They're very rules driven, but now I can see that there's one way to get to this. And then we talk about the different ways and fosters a broadening of the clinical judgment so that they can refine the care. So that's an excellent way to utilize case studies to tell stories. And in fact, we included 2 case studies for you. And then once you have students, novice nurses, look for comparing and contrasting, right? Looking for that sense of what seems normal, what seems consistent, what's different, and why and how. So have new grads present patients, and the preceptor can help interpret findings and point out salience. Focus on how the concept presents in multiple patients, right? Foster that pattern recognition. I used to like to have my students, right, have what's known as a respiratory day. So okay, so today we're going to focus on respiratory system. So what we would do is we would go to the pediatric asthma clinic and have them listen to lungs of asthmatic children, right? And think about how asthma affects children. Then we would take them to a congestive heart failure clinic, right? Which outpatient congestive heart failure clinic, so that they could learn about RALS and congestive heart failure and how it manifests in maybe middle to older adults. And then we'd finally end up in the ICU, right, where people are ventilated. So we would get that kind of thinking, that strategic planning and thinking fosters pattern recognition and improves clinical judgment in novices. The ultimate question here to ask, where have we seen this before? Next, you need a role model. There's no doubt about it. Preceptors are ideally role models. And in one study by Johnson, which is in your reference list, they found that observing an expert nurse role model before simulation demonstrated significantly higher levels of clinical judgment. And students rely on role models for learning to think like a nurse. That's why we're offering this seamless transition utilizing Tanner's clinical judgment model, so that they're getting it in school and then hopefully in school and then coming to you in the practice side. And Bandura said that role modeling can foster mastery, which is ultimately what we're trying to achieve. So one of the ways in which you can do that is to formulate those higher level questions. It's hard to do, but ask questions like, what did you first notice about the patient or the client? Use those preceptor cheat sheets that we gave you in Module 1. How was it that you noticed that this is different than what was expected? Saliency. What else did you need to know? Where have you seen it before? Pattern recognition. What was the client's most important need? And what evidence did you need to make that decision? This is all from Kathy Lassiter's work with the Tanner model. And then lastly, reflection. Reflection, reflection, reflection. Reflection is at the core of clinical learning. Students need structure for reflection. There's a couple of citations there. One of my favorite, it's an oldie but goodie, is Baker, 1996. And it's the only one that I've ever seen, a nursing article, that offers structure for reflection. And so I've listed it here for you. Identification, description, significance, what are the implications, and how would you evaluate your performance at that situation? I have my students, my graduate students, use this as a form for their logs, their learning logs. You might consider that as well. So do look at the article Baker, which I've sent out in the PDF, and hopefully you'll find setting up a structured reflection will add to their clinical learning. So then we have included the Blink case study by Malcolm Gladwell, and we also included a nurse case study which will help you utilize Tanner's model, and hopefully you can begin to see to ask the questions associated with cases to have the narrative pedagogies that are so necessary. So be a bridge. Be a very fun and attractive bridge. And finally, I'll leave you with the references. Then I would just like to say goodbye and look forward to the third installment of our modules. Next one will be how to give constructive feedback. So important with clinical learning. Thank you and goodbye.